Welcome back, everybody. You're listening to This Week in America and the Blue Funk Broadcasting Radio Network. Great to have you with us on the program today. A very important topic. As mentioned, Anna Manayan is our guest. She is an internationally trained and nationally recognized holistic clinician, founder of Immune Matrix. She's a licensed acupuncturist, board certified in internal medicine, and diplomat in anti-aging medicine. She was voted Best Bay Alternative Doctor in San Francisco Bay Area, Covington's 2012 Executive of the Year, and she's with us on This Week in America. Anna, welcome to the program. Great to have you with us.
Thank you very much.
There are so many important things to talk about, and let's jump in right away and talk about Angelina Jolie and what we've heard out of that, and everybody now, women asking questions, is mastectomy the only choice? And let's talk about that. Is double mastectomy the only way to deal with the increased risk for breast cancer?
Definitely not. I can understand the scare, especially if one tests positive for the gene for cancer, the BCRA1 or 2, but there are a lot of other things that can be done to reduce your chances of getting the cancer. And besides that fact, you can get cancer in areas besides the breast, so you're not entirely protected.
Well, let's talk a little bit about those that find out that they may be predisposed, that when they do the gene testing, it's like, okay, there is a well, let's talk about that. We think that there's an increased risk. Is that true? Can we tell if there's an increased risk?
The prevailing opinion right now in medicine is that it's an estimate. There's no statistical facts to back up this medical estimate. It's just saying that we're seeing a correlation of an increase. It could be as much as five times a normal someone who does not test positive for the gene defect. And basically this gene, if it's not defective, it protects you against development of tumors and cancers. But it's very broad. Yes, the breasts are one, but it also protects against colon cancer, prostate cancer, there's ovarian and stomach cancer and pancreatic cancer. So there's many other cancers in the body that are equally affected by this gene defect.
So as people are reading that, yes, it appears that if you have an increased risk, you should take some precautions. These are based not on really sound medical statistics, but what's called an estimate. And you talk about the difference between the two.
Yes, there is. They have not done sufficient research in terms of actually looking at the incidence of positive BCRA1 and 2 findings for those people who are coming down with cancer. It's kind of an after effect testing. There have been studies in different parts of the world in terms of who has the lowest incidence of cancer and who has the highest incidence of cancer, and it boils down to lifestyle. But even with that being said, lifestyle is what can turn on these genes or make them defective. And so, for example, what we don't know is in Okinawa, Japan, they are the longest centurions living on the planet right now. They also have one of the healthiest lifestyles, but we don't know the incidence in the world of this gene defect. Is it the same in all countries? So even within the United States, we don't know what the normal incidence of this gene defect is. So to say that you have it, we know what the gene does. And because we know what the gene does, they're estimating if the gene were to be non-functional, then we think the increase would be such and such. And so that's where the National Cancer Institute is also, recommending and clarifying that this is an estimate. This is not written in stone. This is not, saying that this is definitely going to happen, because also the prevailing research also says that what we do on a daily basis in our lifestyle has a huge impact in altering our genes. It can help our genes or it could hurt our genes. And so that's very important.
You're listening to This Week in America. Our website is thisweekinamerica.us. Information there, of course, you can link on to our guest. Anna's website is very simple. It's chronic fatigueandnutrition.com, chronicfatigueandnutrition.com. Anna Manayan is our guest on the program today. You have people from all over the world who come to you. A lot are referred by physicians to come to you. When someone comes and they say, I'm really concerned, I have an increased risk, is it possible to turn that around, to decrease that risk?
Yes, we do. I tend to specialize in seeing people who cannot take medications, who cannot take supplements, and an integral part of our testing and our evaluation is to determine the body's ability to detoxify. And what we have found in the 13 years that I've been looking at patients with cancer patients is they're acidic and they're toxic. And so I've researched the liver detox pathways to determine how the body detoxifies and also how the immune system, because of inflammation, because of toxic retention, can actually start to interfere with your ability to detoxify. And in which case, that's going to increase your chances for cancer. And we already know in estrogen-based cancers, which is the BCRA1 and 2 genes, if you're not detoxifying your estrogens, then you're going to increase your risk of cancer. And so we can help improve that.
So many people think that, especially again after the Jolie story out there, that removing both breasts, the double mastectomy, is really going to prevent you from getting cancer. Does that eliminate that possibility?
Well, it's going to eliminate breast cancer because you don't have breasts, but you can't take your stomach out. You could take a prostate out if you were a guy. You could take your gallbladder out. You can't take your skin off. So melanomas, it does not, your risk for skin cancer is just as high or higher when you test positive. There are other types of testicular cancer also controlled by that gene. So there's a lot of things we can't go yanking out all these organs and not and be able to function.
Well, exactly.
Yes.
So it's nice to try to take precautions, but there's a limit as to what you can do.
Yeah, and in the case of Angelina Jolie, even though she's taken her breasts out, there's still the ovaries, there's still her cervix and her uterus. So are we going to hear from her that she's yanking those things out too now? Because she tested positive for the gene? I hope to God not. So it's saying that, yes, okay, her mother had passed of breast cancer, so she's feeling, more fear from that. Maybe if her mother passed from uterine or ovarian cancer, maybe she would have elected that surgery instead. I don't know. But I don't think it is not a recognized protocol or accepted practice to determine what surgery to have to prevent cancer based upon your family members dying. So just because mom died of ovarian cancer doesn't mean you should yank your ovaries out if you test positive for the BCRA1 or 2 gene. That is not recommended. And that's not published or anything like that. It's a private decision. It's a decision that must be weighed between the patient and the doctor. But I think what's not being said to the public is there's a lot the public can do, and you don't have to opt out based on fear for these surgeries.
Anna Manayan is our guest on the program. The website, once again, is chronicfatigueandnutrition.com. She's a metabolic immune specialist, also an attorney, donating her time to assist in legal matters concerning expanding insurance coverage for alternative medical care, acupuncture, scope of practice, peer review, rules and regulations regarding the use of herbal medicine. There's a whole other program there just to talk about that and all the battles that you face every day as an attorney in trying to help people out. Let's talk about the recent Supreme Court decision that the genes that we're talking about here don't belong to a particular company. Those are genes that you cannot patent. Will we see, because of that, I understand an offshoot of that is the test that they conduct right now is in the $3,000, $3,500 range. That test likely will come down. Will we see more people that will be able to go through the testing? Therefore, they really need to know what happens if they find they're at an increased risk.
Yes, I mean it hasn't been established, even privacy rights, what the consequences of this information will be. There is some concern about, yes, even though it's affordable, what information would be available to insurance companies or through this database, just like your Social Security information, and how could that be used against you is the big concern. So it's nice to know this information, but right now, the way the laws are, they're a little on the hazy gray side. in terms of what possibly could happen to someone who, say, tested negative for several important genes. Could their employer gain access to this information and possibly use it against them, or not hire them, early retirement? Who knows what could happen with that?
So, like in every ruling comes down, it's like, okay, we've got a couple paragraphs in the newspaper and we read about it. It goes a whole lot deeper than that and ramifications beyond what we're hearing on the nightly news. You mentioned something before, and I want to go back and talk about that. If you find that you are at an increased risk, talk about lifestyle once again, and let's talk about family history, because that was part of the Jolie decision. In fact, her aunt, I believe, died shortly thereafter of breast cancer. How important are those two elements in the decision making, the lifestyle and family history?
Well, your family history is an indication of your gene map and your gene potential. So if everybody has weaker family history in a certain area, which means you have a tendency to have weaker genes in a certain area. But what we equally know now is that what we eat, in terms of our diet and our lifestyle, can actually turn on the good genes, protect your genes. We can actually preserve our genes, or we can actually cause damage through free radicals, for example. Toxins cause free radicals, which are these little hydrogen compounds that actually attack and peck at, like a little bird, your little genes, and they can cause damages to different sections in your whole genetic imprint. So the thing to remember is, yes, you've got this genetic potential, and your prior family generations have actually not had the benefit of the current research and knowledge that food for us and our lifestyle can really help us or hinder us. So we can potentiate and live, the same fate that our parents did if we continue to live the way they did, or if we make changes, even in a family of diabetics. We don't have to become diabetic with the same genes if we change our lifestyle. And some factors, if we have time, I can kind of mention a few of these things.
Please do. Please do.
One of the things is for the estrogen-based cancers, we want to reduce our fat retention. So the more obese anybody is, male or female, fat cells hold on to estrogen. So we're becoming an estrogen storage bank because we're fat Americans. So our breast cancer rate and all these other cancers are going to increase, testicular cancer and ovarian cancer, those types of things. So the first thing is to be aware of your weight and be cognizant of trying to lose the weight, because fat holds estrogen. The other thing is we need to try to detox better. And that's a whole program in itself to understand who's toxic and how do I know if I'm toxic and what can I do. But the number one thing you can do in your life right now to stack the cards in your favor is to have a high mineral diet, dark green leafy vegetables. Our food supply is short on the magnesium and minerals, and we need that to detox. And so if we're doing our green drinks and if we're trying to eat more vegetables, we can really help our liver be able to detox better. And that's just like a basic ground break essential in order to detoxify.
More information at the website, chronicfatigueandnutrition.com. Anna Manayan is our guest on the program. We've got a couple minutes left in the show, and I think what you've said, if I've been following here, is if you find that you're at increased risk, rather than that scares people and they look for something drastic, unfortunately, with the headlines being what they've been for the last couple of months. And what you're saying is that's really information we need because it's not inevitable. We can actually make changes.
Yes, you can make changes. What I know, even in the anti-aging field, is there are a couple products on the market that actually can help lengthen and protect what we call the end caps, the telomeres of your genes, and that will protect you from degeneration and faulty gene replication. So there's a lot of things that are available now that weren't available even 20 years ago that can protect our genes besides the nutrition. There's specific supplements and things.
I know something you work with your patients is immune reset protocol, and we could probably do a full program on that. We've actually only got a minute or so left in the program. Talk just very briefly what that is and how amazing this technology is now.
This technology is computer based. I've been working on it for about 13 years, and I'm looking at the metabolism, the different pathways of the body, and where your immune system is interfering with that. And it gets turned on, the immune system gets turned on when you start to become toxic. And once it turns on, then it starts to interfere with your body to digest fats and sugars, use minerals, use your hormones. And you don't even have to have typical immune symptoms to actually have this be going on. You can have digestive issues that are all stemming from immune problems. So we have a comprehensive computerized testing to look at where is your body possibly derailing your health through the immune system and toxic retention.
Time has gone by way too quickly. We will have Anna back on our program, Anna Manayan. Her website, once again, is excellent information there, and a daily blog, and you can get all sorts of really up-to-date information, her interpretation of news stories, all of that at chronicfatigueandnutrition.com. Basically saying, as we started the program, mastectomy is not the only choice, and she will guide you through all of this. It's been very informative. I look forward to having you back on the program. So much more to talk about, and the time went by way too quickly.
It did. Thank you so much.
Thank you once again. Anna's website is chronicfatigueandnutrition.com. And, of course, all that information at our website, thisweekinamerica.us. You're listening to This Week in America on the Blue Funk Broadcasting Radio Network.